Good day everyone, welcome back to our another video. So in this video, we're going to talk about the EINC protocol or the Essential Intrapartum Newborn Care Protocol. It is a package of evidence-based practices recommended by the Department of Health as the standard of care in all births for health workers and medical practitioners. So under AO 200900025 dated by December 1, 2009, it aims to ensure that health workers have at least the skills and knowledge to provide appropriate care at the most vulnerable period of baby's life. But through the EINC protocol, there is a potential to decrease newborn death for at least half. So before the delivery, please make sure to visit the mother and talk. For example, like this. Good morning, ma'am. I am Raymond, your student nurse for today. I am here to help and guide you before the delivery of the baby. So, how are you feeling right now? Okay. Ma'am, so your cervix is not yet fully dilated. It is only 8 centimeters, so when waiting, just relax and calm down. And please do not drink or eat any kind of food before your delivery, okay? Okay, thank you. Take note that it is not advisable for the pregnant to drink or eat any kind of food because she will just only excrete it during the labor. So the next part is in preparation for the delivery. First is to check the room temperature. It must be 25 to 28 degrees Celsius and free of air drops. So I'm going to use this piece of paper, and if this paper fell in the ground directly, it means that the room is free of air drops. But if this paper fell in the ground way around, it means that we need to check and close the windows and the doors. And let's see and check. So the paper fell directly in the ground, so we achieved the room temperature and free of air drops.
Second is check your equipment needed for the procedure to save time and effort, like this. Third is perform hand washing for the infection control and also remove all your jewelry for this. And I use 2 pairs of gloves in the procedure. The first one is for the delivery of the baby, and the second one is for the foreign care. And the next will be clean the perineal of the mother with antiseptic solution to prevent spread of organisms from the perineal area to the birth canal. At the time of the delivery, ensure the patient privacy, and next is drape the mother properly and ask her if she is comfortable with the semi-upright position. Ma'am, are you comfortable with that position? Okay. Semi-upright position and lithotomy position are desired position for the delivery room. This position aids an easy expulsion of the fetus, thus removing stress and anxiety for prolonged labor. Next is add dry linen across the mother's abdomen for the preparation of drying the baby. So, ma'am, I will count 1, 2, 3, inhale and exhale, then push. Inhale, exhale, then push. Okay, ma'am? Are you ready? Okay, ma'am. Are you ready? Ma'am? 1, 2, 3. Inhale, exhale, then push. One more. Inhale, exhale, and push. Alright. The baby's out 2:30 in the afternoon. Ma'am, this is your baby boy, adorable and healthy baby boy. The next step is immediately thorough drying. Dry the baby through for at least 30 seconds, starting from the face starting from the face, head, going to the trunk and extremities. Next is remove all the wet clothes. Then place the baby in the mother's abdomen or chest with a prone position and a skin-to-skin contact. Next is cover the baby with dry clothes on the baby's head, a bonnet, and a dry clean linen on the newborn's back. Next is the cord care. We need to change the first set of our sterile lungs so I have a new sterile gloves. We need to exclude the second part by palpating the abdomen for the preparation of giving oxytocin injection or an IM for the mother. So ma'am, I will administer you some oxytocin, just a quick. Okay, I'm done. Oxytocin procedure is uterine contraction during third stage of the placenta. It is to prevent the postpartum bleeding or hemorrhage. So next is palpate the umbilical cord at least 1 to 3 minutes. If the umbilical cord stops, clamp the cord for at least 2 cm by a sterile plastic clamp from base. And next is clamp again at 5 cm away from base. Milk it before you clamp. The next is cat and the cord slightly near to the plastic clamp. So next is performing the remaining steps of our management of the third stage of the labor and wait for the strong uterine contraction, then apply the control cord contraction and counter contraction on the uterus, continuing until the placenta is delivered. Next is massage the uterus until it's firm and inspect for lacerations or tears on the perineal area of the mother. So in this procedure, we should inform the mother for this procedure. Ma'am, I will massage your uterus until it is firm, and also I will inspect any lacerations in your lower vaginal area. Is that okay? Okay. Massage it carefully. If there's any laceration in the perineal area of the mother or tears, we should repair it as necessary as needed. Next is when the placenta is delivered, we should examine the placenta carefully, its completeness and abnormalities. So now, let's examine the placenta, its surface, the color, and the completeness and the abnormalities. Okay, so next is dispose the placenta, flush the perineum, and next is apply perineal pad, napkin, or cloth. After we clean the mother, next procedure is check the baby and the mother's condition. For the baby, check for its color and breathing pattern. Note that the deep and shallow breathing of the baby. And the next is check the baby's skin color. Then next is check for the mother's condition, if she is comfortable and if the uterus is contracted. Ma'am, how are you feeling right now? Are you already comfortable? Okay. Okay. Next is decontaminate all the equipment. These, all the equipment that we use. We should decontaminate in 0.5% chlorine solution all our used equipment in 10 minutes before disposing it to prevent risk. And the next procedure is the unang yakap or the breastfeeding. Advise the mother to maintain skin-to-skin contact on her baby, and the baby should be in a prone position like this. In a prone position with the head turned onto the one side, and advise the mother to observe feeding lines and also instruct and support for the mother's breastfeeding position, especially those who is first timer, and the positions and attachments, and also we assess and wait for full breastfeeding to complete. So ma'am, maintain skin-to-skin contact with your baby. This will serve as your first skin-to-skin contact or first attachment and first breastfeed to your baby. And ma'am, observe for breastfeeding cues like tonguing, licking, and rooting. And also ma'am, I will instruct or support you for breastfeeding, so don't worry, for breastfeeding position and attachment for your baby. Okay ma'am? So ma'am, I will leave you for a while and I'll be back soon after you breastfeed your baby. Thank you. After breastfeeding, we need to administer eye ointment, medications, vaccine to the baby, and we should inform the mother for this method and also explain to her why we are administering these medications. So ma'am, I will administer medications to your baby, the eye ointment, the vitamin K, the Hep B vaccine, and the BCG vaccine. Ma'am, for the eye ointment, this is to prevent your baby from gonorrheal infection. Baby, don't pause the video. Next will be the vitamin K. It is to prevent blood clotting. I will administer this on the vastus lateralis of the baby or the left thigh. Next will be the Hep B vaccine to prevent liver disease on the right vastus lateral or in the right thigh. So next will be the BCG vaccine. This BCG vaccine is for the prevention of TB. Okay, I'm done. Thank you. The next is core care. We need to wash our hands, assuming that I already washed my hands. And if the stump is soiled, we need to clean it by warm water and clean clothes. Next is explain to the mother that she should need to seek care if the umbilical is red or has draining pus. Early washing or bathing the baby should be done after 6 hours or the next day after the delivery. We should also instruct the mother with this. Instruct the mother rather for maintaining the skin-to-skin contact like this with his baby and breastfeeding. Next is continuing monitoring for the baby and the mother's condition. For baby, note its color, breathing, and temperature. And for the mother, it's the vital signs and discomfort. Now last is the documentation. Don't forget to document all the procedures and the condition of the mother and the baby. So that's all for today. Thank you for watching. Bye!